I'd like to talk about uterine fibroids. It's a very common condition in women. It's the most common pelvic tumor seen in women. It's a benign tumor, so it's not cancerous. It affects up to 80% of African American women. So this is an important topic for all women, but it's particularly important for African American women to know about fibroids. Usually fibroids are seen in women typically in maybe their late 20s or early 30s to 50s. Nobody knows where fibroids come from, but once they arrive on the scene, if you will, they grow with estrogen. That's why fibroids can grow very rapidly when a woman is pregnant, and why it tends not to be an issue for most women once they are in menopause. These tumors are hard and firm. They're like rocks, and sometimes women can feel them. And as these fibroids grow, they will start to cause symptoms by pressing on things. Fibroids can be really in one of three locations in the uterus. There are fibroids that are located right underneath the lining of the uterus. That's called a submucosal fibroid. There are fibroids that are underneath the outer covering of the uterus, and those are called subserosal fibroids. And then the third, the most common, are intramural. They are in between those two. They are in the kind of meat, the muscle of the uterus. And based on the size and, more importantly, the location of these fibroids will determine, first, if a woman has any symptoms at all, and a lot of women don't, or if they have very significant symptoms, as a number of our patients do. So, for instance, these submucosal fibroids located just underneath the lining of the uterus, very centrally located fibroids next to the cavity of the uterus. The uterus is hollow. So those fibroids, since they're right underneath the lining, they often cause very heavy menstrual periods. These periods can last multiple days, sometimes more than 7 days, sometimes 2 weeks or more. The typical menstrual period will last around 4 or 5 days. These women that have submucosal fibroids bleed a lot heavier and longer. The periods not only is menstrual blood coming out, but a lot more blood than normal. Women might report blood gushing out or flooding. They may have accidents in blood, soiling clothes or linens. They may pass clots. They can be very small clots or very large, very concerning clots as big as your palm or your fist. It can be very frightening for some women that have these heavy periods, and they have them repeatedly. And so women, that's the most common reason why women have heavy periods, are these benign fibroids. And sometimes women don't realize exactly what is heavy. It's very important, if you're having these abnormally heavy periods, to seek out a physician that can help you. Typically, it's an OBGYN, although it doesn't have to be an OBGYN. Those are the doctors that see most of the abnormally heavy bleeding that occurs. Fibroids, as I say, not only cause bleeding, but they can cause pelvic pain, and they can cause increased urinary frequency. Again, it depends on where they're located in the uterus. Those that are kind of in the front of the uterus can press on the bladder to cause increased urinary frequency. If they grow kind of laterally and press on pelvic nerves, they can cause abdominal pelvic pain, pressure. This pain can radiate into the lower back, down the legs, and be confused for sciatica pain from lower back issues. So sometimes patients can have lower back pain that radiates into the legs. It has nothing to do with their low back or spine. It's because they have fibroids pressing on pelvic nerves to cause this pain. If fibroids are located near the cervix, it can cause painful intercourse. Those in the back of the uterus can press on the colon and cause difficulty moving your bowels or painful bowel movements. So there are a number of symptoms that might alert a woman that she is dealing with fibroids or may be dealing with fibroids. So the most common symptoms, again, are heavy periods, pelvic pain, and increased urinary frequency. Those are the most common symptoms. Now, when a woman is bleeding so heavily, naturally with this blood, you're running a deficit. You can't possibly replace the blood that you're losing when it's this heavy. So not only is a woman losing blood, she's losing iron and hemoglobin, which is in the red cells that she's losing. And so it's not surprising that when women are running a deficit of iron and hemoglobin, the main symptom here is being very fatigued and tired, weak. And patients are very surprised when I ask them about if they chew or crave ice. They feel like I'm clairvoyant. I'm looking right through them, because how would I know that? It's a sign of chronic anemia that's very common. And then depending on the severity of those symptoms, different treatment options are possible.